Did you know there's some interesting new research that shows that 93% of Americans struggle with metabolic disorders, with prediabetes and diabetes being the majority? Well, now we have some exciting new technology called continuous glucose monitors that are helping with the fight against diabetes. I'm excited to be joined today by Willis Knighton endocrinologist, Dr. Michelle Chico. So, Dr. Chico, what exactly is a CGM and how do they work?
So continuous glucose monitors are wearable devices that are FDA approved. They check your blood sugars continuously, and you can check see your sugars in real time. So you don't have to continuously prick your finger to get blood sugar readings. So it's a very convenient tool, and patients can look at their blood sugars and follow trends and be able to make changes in their activity, in their diet, and in their medications accordingly. So basically, it's a sensor. It's really small. It comes with a transmitter, and the transmitter is what transfers the information onto either your iPhone or your Android, or if you don't have those, then it goes to either a receiver or a reader. This goes on your arm. It's really tiny, and it's a very easy, painless process. You just open it, you put it on your arm, and obviously not on your clothes, and then you press a button and it gets in your arm, and it's, like I said, painless and easy.
That's great news for patients, because as an educator, what I normally see is that this has really been a deterrent for many patients to check their blood sugars and really manage their diabetes well when they don't know what their blood sugar. They just wait till they go to the doctor and get that one finger stick. So how do you see this as a role in playing for the management of diabetes?
So it's really exciting that we have this tool because it's very convenient for the patient. So that's a huge win for us. And they don't have to, continuously prick their finger, like I said. But it's really great because they can look at their blood sugar trends. So they can see what foods are making their blood sugars go high. There's also a trend arrow. So if the trend arrow is pointing diagonally, it means your blood sugar is staying stable. And if it's trending upwards, it's going to diagonally point upwards. If it's vertically pointing upwards, you're in trouble, and it's high and it's red and starts beeping. Similarly, if it's gradually decreasing, it's going to diagonally point downwards. And if it's vertically pointing downwards, it's alerting you that it's low, it's red, and it starts beeping. Patients really like this because their fears are alleviated, because a lot of patients are scared of going to bed and having a low blood sugar when they sleep. So this gives them a lot of comfort because it will beep if their blood sugar is dropping, and they wake up and they can, have a snack or take care of the low blood sugar.
A lot of security, especially for those patients that might live alone or don't have, someone there to, to help alert them or see, if they've got some sort of issues. And so I'm excited, about this technology. I used it myself as a trial, even though I'm not a diabetic, but I don't want to be a diabetic either. So there's so many metabolic disorders that this could be helpful for. Do you see this as not just management, but maybe also prevention?
Definitely. Left up to me, I would want every patient with insulin resistance to have a continuous glucose monitor. And of course, I would want all patients with diabetes to have continuous glucose monitors. Unfortunately, I don't get to choose. Insurance companies don't cover it in most patients who are not diagnosed with diabetes, obviously. But patients who are interested in prevention can pay for the continuous glucose monitor, and they can use it for just a couple months, but it really gives them valuable information, and they're able to change their lifestyles, look at what exercise does to their blood sugars. They can, change the way they look at food and make healthier choices. Now, for your patients with diabetes, it really helps them choose their foods better. It helps them exercise, stay active. And when patients can actually look at their numbers, it motivates them. So they stay on target.
We manage what we measure. That's really how I educate a lot of my patients. And I think it is such a great investment in your health. So even if your insurance wouldn't cover it, even just paying for like a month or 2 months to see how maybe sleep would impact your blood sugar, or stress, or food. We know food has, some of the biggest ones, but a lot of those lifestyle changes, you might not think. And for me, it was a big aha of what stress, even positive stress, was doing to my blood sugars. Now, are there other CGMs on the market, or how many are there to choose from?
Right. So there's 3 continuous glucose monitors right now. The Dexcom, the Freestyle Libre that's made by Abbott, and the Guardian Connect that's made by Medtronic.
So lots of great to choose from, and it's just easy, very convenient, and more specifically, not painful. So hopefully you can talk to your doctor and encourage, other patients to talk to doctors to see if a CGM is right for you.